Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. If you missed our live show, it is only available on our YouTube channel. What a fantastic conversation we had with Director 4 David Muntz, Sue Shade, around what's next in health IT. You can view it on our website with our new menu item, appropriately named Live, or just jump over to the YouTube channel. And while you're at it, you might as well subscribe to our YouTube channel and click on Get Notifications to get access to a bunch of content only available on our YouTube channel. Live will be a new monthly feature only available on YouTube. How many times did I say YouTube in that paragraph? Subscribe to YouTube. We're going to have some great stuff over there. This episode, and every episode since we started the COVID-19 series, has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show. Today's conversation is with Ed Gillispie and Cathy Meister with Lenovo. Ed is the VP and General Manager of Public Sector and Healthcare, and Cathy is the leader of Healthcare Sales for Lenovo in the U.S. Good morning, Ed and Cathy. Welcome to the show.
Hey,
Hi, Bill. Great to reconnect with you. How are you today?
Good. I'm really looking forward to this conversation, Ed. We've known each other for a long time. Cathy, not as long, but we're getting to know each other as we go through this. I think the first question I need to ask you is, which college do you think was most hurt in terms of national championships as a result of the COVID crisis?
Well, I have a feeling you might be baiting me, Bill, with my alma mater, University of Texas.
Yeah, well, I sort of am, because I do want an opportunity some way to talk about the fact that Baylor did defeat Texas in football this year, which doesn't happen all that often, so you have to talk about it.
Yeah, unfortunately, that's true, and I think you've got several wins racked up there in the column that I'm not proud of, but I do respect Baylor University. It's a wonderful institution right down the road from me. In fact, as you see in my backdrop, this is Austin and the skyline, and go to Waco often, and respect that institution and hate it when you guys beat us. Yeah.
Well, I became a fan as I start to spend more and more money there as my daughter continues her education. So I will continue to sport the Baylor colors as the show goes on. But I'm really excited to talk to you guys. You guys work with a lot of healthcare clients across the U.S., a lot of different ways that you're supporting them. And, what I really wanted to do was, take a look at what's been going on, what you guys have been doing, and hopefully to start to lean into where it's going to go next. That seems to be where the conversation is going. So let's start at the beginning. Give us an idea of some of the ways that you've supported your clients during the pandemic.
Sure. Great. Thank you, Bill. Appreciate it. Just by way of background, let me give you a little bit on the company. As Bill mentioned, I lead U.S. Public Sector and Healthcare business. Lenovo, for those of you that may not be aware, is the number one PC provider worldwide. Also number one on the supercomputer list for the top 500 supercomputers. Our vision as a company is intelligent transformation. Simply put, what does that really mean? It means that we're creating a portfolio of solutions where devices and data center infrastructure work together with software and services to improve people's lives and transform computing environments more efficiently. We've got a strategy called 3S, which is smart IoT, smart infrastructure, and smart verticals. Today, we'd like to talk about smart verticals specific to healthcare and really what we're doing, because it's right in the middle of this COVID-19 crisis that we're all facing, as I'm sure everybody is dealing with, fighting the virus. Lenovo's felt it, both as a global company as well as serving all of our customers. We've responded with lots of local leadership acting to take care of our local teams around the globe, making sure that that's priority number one. Also giving back to communities. To date, in fact, Bill, we've given over $12 million to hospitals and schools, community partners around the world. A couple specific philanthropic donations we've made, about $2.5 million of equipment and infrastructure to hospitals, about $500,000 of donations for N95 masks, part of the PPE solution, Another $2.5 million of hardware donations for distance learning in education, both K through 12 as well as higher education, which are markets that we serve in a dedicated fashion. We're also helping customers providing technology in this crisis. And we've been very busy over the past couple of months, as you might expect, with frontline workers, especially in healthcare, helping them leverage the strength of our global supply chain and our purchasing power, frankly. We are the #1 PC provider, as I mentioned, and that provides some advantages and benefits to customers. And we've been serving customers in healthcare provider space across the U.S., from California to the Midwest, including New York, where we delivered and helped set up some technology devices for some hospitals in New York City where it's been most hardest hit. So, Bill, those are some examples of kind of what we've been doing recently and kind of what our strategy is and focus in the company, as well as specific to smart verticals in healthcare.
That's fantastic. I love the philanthropic work. I also like the the smart IoT and smart infrastructure. I'm sure we're going to come back to that as we get going. Cathy, I wanted to bring you into the conversation because you went to Carnegie Mellon and we started on this football thing. I apologize. It's just something that Ed and I have done for years. He is always brandishing his Texas hats and things to that effect. But one of the things I wanted to really hear from you is what were some of the biggest challenges your clients had to overcome with this COVID fight?
Well, Bill, and I want to start by saying, first of all, so while my alma mater maybe can't compete from a football perspective, I will say from a professional football perspective, my hometown of Pittsburgh is right up there at the top. So just want to get that out there, okay?
Got it.
But on a serious note, and I happen to be based in New Jersey, so I feel very close to really the epicenter of this pandemic. And certainly there's been a lot of challenges that our health systems have been dealing with. And we saw these challenges really from our perspective around two different fronts. One was this forklift effort to work from home for those employees who could be unable to work from home. And then also there was just the preparedness within point of care sites for combating the virus. For those non-frontline workers who could work from home, certainly many of them needed a device, right? They needed a mobile device for at home. Maybe they needed peripherals. Maybe they needed a monitor. They needed to be able to collaborate. They needed some education, frankly, on using those tools. And as Ed described, there was a huge surge to work from home, it certainly put pressure on supply chains across the IT industry, right? And we worked very hard with many of our health systems to try to address those needs as best we could to support standing up those immediate needs for work from home. We've also helped with some best practices around working from home because we are largely a mobile company ourselves, right? So work from home wasn't necessarily new to us, and we've really tried to share those learnings back with our clients. On the other side was within the walls, right, of the health system and the challenges, and these were many, right, for CIOs and for IT teams. This is preparing for surge in patients, right? So expanding number of ICU beds, standing up field hospitals, creating command centers, all very intensive projects that amazingly we've seen that normally would have been months to stand up some of these operations happening in days, if not weeks. And then the other challenge that really played in was simply preparing for the shortage that occurred and is occurring in terms of physicians and nurses, and then the massive shortages from a PPE perspective. So how could technology be used to help deal with some of those issues and certainly ultimately help protect more patients and physicians?
It's interesting as I listen to you guys talk, and we're hearkening back a little bit to talking about what was it like when the crisis first hit. But it sort of dawns on me as we're talking about this, and I've talked to some people who've said, Bill, you might be moving on too quickly because we're seeing this surge sort of, it hit major cities, and now it's going to start moving out. And so people are still going to be in that phase that we just talked about, where they still have to, I don't know, acquire equipment and think of new solutions and those kind of things for rural locations. So it's going to be interesting. So even as we move through this conversation of talking about the beginning of the crisis, it's going to sound like, hey, we're moving out of it, but some communities are just still moving into it, and there's still an opportunity there. But so we've moved from really react. So we have this crisis, we reacted, we're stabilizing in the process. How has the work shifted from your perspective, from your vantage point, as we anticipate a surge in some of these other communities?
Yeah, sure. Yeah, great point, Bill. I mean, in many cases, we're seeing, a wide range of impact, and it's certainly caught, I think, this industry as well as most other industries flat-footed with not having true business continuity, as we've talked multiple times. And you being a former healthcare CIO, you know how important it is for uptime, and probably a lot of your listeners here on this podcast. And really, I would say the pandemic has just accelerated the digital transformation that a lot of folks are on that journey, driving adoption of, what we'll call virtual healthcare, telehealth. I mean, telehealth is not new, but it's certainly accelerated digital transformation. And I would say the healthcare delivery system has been, grossly underserved. Certainly the business model, as we've all been trying to transform that and do our part. But the moves to expand and maybe loosen some of the requirements, for example, CMS expanding reimbursement to telehealth services, the social acceptance of both physicians and patients, allowing for that to be a viable delivery for healthcare systems. And we know telehealth's not new. Certainly the groundwork for infrastructure and healthcare workflows have been in place for many, many years. We just see over the past few months, thankfully, that this has just created an exponential increase for telehealth encounters. I'm sure all of you have experienced that either personally or professionally. I know I have, and it's been a great thing. This acceleration of telehealth for health systems, I think, is going to be a part of the new norm. At least I certainly hope so. The recent leniency on HIPAA compliant platforms and devices, I think, has helped in the crisis. I think that will change back, but I think the ability for us to be able to deliver, things like virtual rounding in acute care settings and remote patient monitoring, even home health care, are going to be areas that we're going to accelerate our advancement in healthcare delivery, which is exciting for me, having served the healthcare industry for many years. And as a technology provider, we feel very responsible to help play a key role in doing that. So we're excited with some of the solutions that we have. We want to talk about a few of them today, specifically Lenovo virtual rounding with our Microsoft Teams solution is allowing caregivers to visit with patients remotely. And it maintains the patient relationship, also decreases, PPE requirements, certainly decreases the risk of infection and transmission. So when we think about smart verticals and things that we can do to provide technology solutions, both hardware, software, services, and partnerships, that's what we mean by being a responsible technology provider for solutions. I know vendors like us tend to throw the word solution around a lot, but this is a very pragmatic approach that we have. And we think, frankly, a responsibility that we have, being the number one PC provider and having a breadth and depth of solutions at our disposal to be able to provide this marketplace in need. And frankly, I think at the epicenter of everything that we're doing right now, helping shape what the new norms will be. So those are some initial thoughts that I have, Bill, around, kind of what we've been seeing and what we hope will continue to accelerate in the industry.
Yeah, one of the things I'm hearing from CIOs as I have these conversations is, we have all these new Lego pieces to play with. You talk about virtual rounding, and when we think about rounding, we think about going from one hospital room to another.
Right.
In reality, virtual rounding, we could do it from one home to the next home to the next home with an entire team of care providers, which really changes the game. So let's talk about home-based care, virtual remote monitoring and tracking and those kinds of things. How does Lenovo approach that, and what do we anticipate to be the new focal point for healthcare?
So I'd love to jump in on that question, Bill. Lenovo has been focused on remote patient monitoring for a while. The rise in chronic conditions it has something that's been going on for a while, and recently, certainly, these chronic conditions, which have put a certain population even at greater risk with COVID-19, perhaps to shed more of a spotlight on the need to address this challenge for our country, for the world. These chronic diseases and conditions that are contributing to nearly 90% of healthcare costs require focus and targeted care, consistent targeted care, if outcomes are going to be improved. So with Lenovo Virtual Care, we're providing really a continuous connection between the physician and the patient, essentially a bridge between how the physician can monitor the patient in his or her office to being able to monitor them from their own home. And Lenovo Virtual Care is a little bit different from other solutions because of our virtual assistant or virtual nurse Rosie, who encourages positive habit formation and care plan compliance. Lenovo Virtual Care really allows the provider to remotely monitor the patient's compliance, guide them through adherence to their care plan, and even educating the patients or family members and caregivers around the condition. And this solution really combines trusted Lenovo hardware, so it's a tablet, as well as biometric, FDA-approved biometric devices. So, for example, a glucose monitor or a blood pressure cuff, right? And then AI-powered software. And that's really where that habit formation and reinforcement of the care plan comes together.
Yeah, the thing I like about that is you're bringing together all the components, right? The biometrics, AI, the software. You're bringing the hardware together, and hopefully creating that solution. One of the things I wanted to, really, as a former CIO, I have it in the back of my head. It's like, we're heading into a time that's going to be really tight financially for healthcare systems. With the loss of the elective procedures and the rise of the loss of commercial payer with 30 some odd million people being unemployed. I guess, Ed, I'll go to you on this. How is Lenovo going to partner with health systems to help them to navigate this?
Yeah, well, great question. You're absolutely right. Cathy and her dedicated healthcare team in the U.S. have been dealing with this, now for several weeks as elective surgeries are down or non-existent, and hospitals are not in their normal operations, and obviously to have a huge financial impact. So they're going to be looking for creative ways to deliver technology solutions and ultimately provide patient outcomes and operational efficiencies. And we hope leaning on folks like Lenovo. One of the ways we are addressing that with this specific solution that Cathy unpacked around virtual care is providing a monthly subscription service. So being able to deploy hundreds, if not thousands, of this technology in homes and be able to do that on a subscription basis so that there's not a big upfront cost in operationalizing that versus capitalizing that if the health system we're allowed to do that. And we think that's an advantage for us. We think it's good for our customers and our customers' customers.
Yeah, and as I think through this, there's going to be an awful lot of pull around digital and digital solutions like the one you're talking about, which actually is going to improve care just across the board, right? We're going to be able to help people with their care plans, keep them moving towards better outcomes, because we've always talked about how do we increase the number of touch points between the health system and the patient, because generally speaking, someone who's healthy, like the three of us, might only see a doctor once or twice a year, maybe three times a year at most. And a lot of care happens between those settings. And COVID has really increased the need for some of these specific things. But as I was saying before, I think a lot of health systems now are going to look at these building blocks and go, hey, we can do this for our chronic patients, but we can also do this for our, walking well and our active, healthy patients. There's a lot of ways to increase the number of touch points in a pretty cost-effective way. And I think that's what I'm hearing from you guys.
It is, for sure. Thank you, Bill, for teasing that out and being so intuitive. I mean, the one of the things I loved working with you when you were a healthcare CIO was how demanding you were of yourself, your vendor partners, and when we reached that status with you, how much you trusted us to be a true partner, because you were right in the middle of digital transformation many years ago when folks didn't know what that meant. We're now squarely in the middle of it years later. Now this pandemic is accelerating that opportunity for all of us to take advantage of the acceleration of really scaling solutions that are very practical and very real. We've got them. This smart vertical strategy for us is not theoretical. It's very practical. Virtual rounding solution and the virtual care solution are just two examples of things that we are launching into the market and scaling, and we're very excited about it. Continuing to serve the healthcare customers with these type of technology solutions, we're very committed to doing. And we love working with customers like you that are innovative, that are wanting to challenge the status quo, to be in the forefront, helping lead with technology. We think that this virtual care solution is right in the heart of our smart vertical strategy because it enables practically care providers to coach patients through individual care plans, improving, patient care experiences, patient satisfaction, even incorporating, family engagement, which I don't know about you, but I've been engaged with my family more than ever with our three daughters at home from college. And whether you're together in the confines during a COVID pandemic or whether you are dispersed, you need your care team, especially if you are a chronic care patient. And we believe that this is right at the helm of providing that in terms of helping deliver care management with the family and with your loved ones that may be critically ill or chronically ill. And it's certainly aimed at helping reduce hospital admissions, which we know is a huge issue. We don't want to use hospitals as a regular care need. So this innovative approach that we're taking at Lenovo, specifically in the healthcare US, to provide a cost-effective solution for chronic care management is really important and a big passion of mine personally and of the company's. We plan to continue to invest in smart vertical solutions and provide more value to our healthcare provider customers. And we just appreciate, Bill, the opportunity to talk a bit about it today and share it with all of your listeners, and hope we have an opportunity to serve more of our customers with these type of solutions.
Yeah, and thank the two of you for taking the time to meet with me today. We'll have to stay connected and see how things progress. I'd love to potentially pull some of your clients in 6 months or so, 6 months or so, and hear about some of the things that we've really been able to do to push all of these things, push care forward, really.
We would love to do that, Bill. Thank you for the time today, and hook 'em horns.
Thanks, Bill. Great being with you today.
I'll give you. So Cathy, what is the phrase? We have hook 'em horns. What's the phrase from Carnegie Mellon? You have no idea, do you?
Oh goodness, you put me on the spot, Bill. Sorry.
That's all right. I don't know what the Moravian College one is either. Don't worry about it. But but I do know the Baylor one, sick 'em bears. So
yes.
Thanks for coming on the show. I really appreciate it. That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, serious healthcare and pro-talent advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email and let them know that you value and you are getting value out of the show. And also, don't forget to subscribe to our YouTube channel while you're at it. Please check back often as we will continue to drop shows until we get through this pandemic together. Thanks for listening. That's all for now.